Hey everyone! Today we're going to talk about something that hits right at the heart of how we connect with people our words. We're talking about aphasia. It's a condition that can lock away a person's thoughts and personality, leaving them searching for words they've known their whole lives. Just stop for a second and really try to picture it. You have a thought, a feeling, a joke, crystal clear in your head. But the path from your mind to your mouth, it's just gone. You can't find the word for water or the phrase, I love you. It's an incredibly isolating experience, and it's a daily reality for millions. So what is it, technically? Well, aphasia is a neurological disorder. This isn't a problem with your hearing or with the muscles in your mouth. Nope. It's an issue with the brain's language centers themselves, the parts that handle speaking, understanding, reading, and writing. And this, right here, is probably the most important thing to get. A person with aphasia is just as smart, just as witty, just as themselves as they were before. Their intelligence is completely intact. The condition puts a mask over their abilities. It absolutely does not erase the person underneath. Okay, so to really wrap our heads around what aphasia is, it's super helpful to also understand what it isn't. There's a common mix-up here that we really need to clear up, and that's the difference between a language problem and a speech problem. So here's the main difference. Think of aphasia as a problem with the brain's language software. It's a cognitive thing. The brain has trouble finding and organizing the words it needs. A motor speech disorder, on the other hand, is more of a hardware problem. The brain knows exactly what word it wants to say, but it can't get the muscles to cooperate to say it clearly. They're two very different issues, even though someone can have both at the same time. So how does this actually show up day to day? Well, one of the biggest symptoms is something called anomia. You know that frustrating tip of the tongue feeling we all get? Imagine that, but for tons of words, all the time. You might also see paraphasia, like saying television instead of television, or a grammatism where speech gets really clipped and choppy, leaving out all the little connecting words. All right, so that leads us to the next big questions, right? How does this even happen in the first place? And just how many people are we talking about here? The number is pretty staggering. About 2 million people in the US alone are living with aphasia. To give you some perspective, that means it's more common than conditions like Parkinson's disease or multiple sclerosis. And yet, so many of us have never even heard of it. The number one cause, by a long shot, is a stroke. Somewhere between a quarter and almost half of all stroke survivors end up with some form of aphasia. But as you can see, it can also happen because of a traumatic brain injury, a tumor, or even some brain infections. For most of us, our language skills are packed into the left side of our brain. Here's a great way to think about it. Imagine your brain is a giant library. After the injury, all the books, all your words, memories, and ideas are still on the shelves, perfectly fine. But the card catalog, the system you use to find the books you need, is a total mess. The information is all there, you just can't get to it easily anymore. Now, it's really important to know that aphasia isn't just one single thing. It's more of an umbrella term for a bunch of different disorders. And one of the main ways they're grouped is by whether a person's speech is considered fluent or non-fluent. This table gives a great little snapshot of the two types you hear about most often. With expressive, or Broca's aphasia, speech is really slow and effortful. It's non-fluent. But their understanding is usually pretty good, and they're often totally aware of their struggles, which, as you can imagine, is incredibly frustrating. On the flip side, you have receptive, or Wernicke's aphasia. Here, the person can speak fluently, but the words might not make any sense. Their comprehension is poor, and they're often not even aware that they're making errors. So here's a perfect example of that non-fluent expressive type. Walk dog. It's just 2 words, but it gets the main idea across. The thing is, it could mean, I need to walk the dog, or have you walked the dog? You really rely on context to figure it out. Now compare that to receptive aphasia. The speech might sound totally normal in its rhythm and flow, but the words are just off. So if you asked, are you gonna walk the dog? They might reply with something totally unrelated, like delicious taco. The words themselves are real, but the meaning is completely lost in the conversation. So after something like this happens, what's next? Is it possible to get your language back? Let's take a look at what the road to recovery and rehabilitation is like. You know, the human brain is pretty amazing. In the first few months after the injury, there's often this period of spontaneous recovery. The brain basically goes into overdrive, trying to heal itself and build new pathways around the damaged spots. It's a really critical time for improvement.
But that natural healing process usually needs a big push. And the research is really clear on this. Intensive therapy can make a world of difference. 2 to 5 hours of dedicated speech and language therapy every week is often what's recommended to really help the brain build those new connections.
And this therapy isn't just about practicing words over and over. It's a very personalized process. It starts with a deep dive to figure out exactly what's going on. From there, the therapist and the patient work together to set real-world goals. And that last part, involving communication partners, that's huge. Teaching family and friends how to communicate better is a massive piece of the puzzle. This quote really gets to the heart of what recovery looks like. For a lot of people, the goal isn't necessarily getting back to 100% of what they had before. It's a slow, steady journey of getting better and, crucially, learning new strategies, like using gestures, drawing, or even apps on a tablet to connect with people and get their ideas across. And that really leaves us with this final thought, doesn't it? When we know that the person is still in there, with all their thoughts, their humor, their intelligence, how can we all be more patient, more understanding, and just better communication partners for people who are fighting so hard to be heard? What can we do to help them find their voice again?